So I flew to the US, to Houston, to get a COVID vaccine. And I just got it. Now, remember, I'm not a US resident. I came here on a B1, B2 visa, and there's a lot of gray unknowns about this. I couldn't find any information online. It's all about word of mouth and whether you can and what you should and shouldn't say. So I guess that just makes things worse, doesn't it?
Rumor of extra vaccine doses caused chaos near vaccine tourism.
Fly into town, receive the vaccine, and then go back home.
The point is, I managed to get my veins pumped with 5G Microsoft mind control chips. And yes, there are some moral and legal implications of doing this, which I'm going to discuss in this video. But more importantly, I'm here to tell you how this worked from my own experience. I'm here to tell you how much it cost me, how I arranged the logistics, and yes, to talk about those implications as well. Is this the nicest hotel? No, but it got the job done. So the first thing that you have to understand is how federal versus state mandates work and how they have affected the turnout to vaccination across the US.
Crackdown on vaccine vacations. You now need proof of residency in order to receive the first dose of a COVID-19 vaccine here in Florida.
Yeah, there's no citizenship requirement to get the COVID-19 vaccine. And the public health reason for that is really pretty simple. That's the best way we have to slow the spread of COVID-19 and make sure that everyone is protected.
So the official Department of Health position is the DHS and its federal government partners fully support equal access to the COVID vaccines and vaccine distribution sites for undocumented immigrants. DHS encourages all individuals, regardless of immigration status, to receive the COVID-19 vaccine once eligible under local distribution guidelines. So the point here is, federal government says everybody, regardless of immigration status, can get a vaccine, and then it's the local distribution, the state, that decides which are the local requirements to get a vaccine, which in many cases outrule undocumented immigrants simply because they don't have a proof of address or a proof of residency in the state.
Suzanne, at least 14 people wrongly turned away because of their legal status in the U.S.
Right. Well, this all came out in the public because of a young man who took his father to get vaccinated, and his father waited for 4 hours and was denied because he was asked for citizenship proof. And when it came out, there was pressure to help this man out. They responded. They said they would help him, but a local advocacy group said, hey, that's not enough. There needs to be more done. You need to make sure that everyone knows that they can get a vaccine.
State mandate is everybody gets a vaccine, no questions asked, period. Yes, again, this is made for residents, for people who live in the state. So tourists and people who are taking that dose elsewhere don't necessarily apply here, but once again, I'll get to that in a sec. Over the last few days, vaccination has slowed down across America. I mean, the doses are available, but there's simply a good amount of people that don't want to get a vaccine.
Demand for vaccines is slowing down as thousands of appointments go unfilled.
Largely rural populations are just not coming out to get vaccinated.
This site in Dallas can do 12,000 vaccinations a day, but on some days they're doing as few as 4,000.
Now, I've been considering doing this for weeks now, but I couldn't help feeling guilty, honestly, using a dose that was meant for somebody who is a resident. They are first in line, and they honestly get first dibs because the US did much better than my country.
Basically, rich countries got vaccines, poorer countries didn't. In Brazil and India, health systems are being pushed to the limits at the same time that the US is quickly opening up vaccinations for anyone.
The point is, I picked Texas. I used a website called Vaccine Spotter and another website called Vaccine Finder, which requires a VPN in order to work outside of the US, to find a vaccine. So that allows you just to enter a zip code and it'll display all the different vaccine locations around that zip code. And it will even let you pick which vaccine dose you want. Not really knowing if I was gonna get rejected here, I went ahead and booked more than one appointment. So I've booked 3 different COVID appointments at different places across the city, just in case I get rejected or there is a requirement that I can't fulfill. My plan was to go to one of these places, see if I can get a vaccine, and if it works, then I'll cancel the other appointments, but just to have a plan B, because I'm only here in Houston for 1 day. So this is appointment number 1, 7:30 in the morning. I'm a bit nervous, I have to say. My intention was to test and see if I could get a vaccine, and of course cancel these appointments as soon as I got a vaccine. So I know that the process to book that appointment is pretty straightforward on Walmart, on H-E-B, and on Walgreens. You all need to register for an account, but it's pretty straightforward, no extra information required. And more importantly, it lets you pick and see which vaccine you've booked, and your confirmation actually has the vaccine that you are going to get. So normally you can only book appointments about 1 week in advance. I've been actually monitoring this for a few weeks now, and a month back, end of March, you would see that most appointments were booked and that most appointments were really, really far away from population centers. But I booked my appointment probably like Sunday, today's Thursday, and the whole day was kind of free and available. So my assumption here is that, yes, it seems that in Texas, most people that wanted to get a vaccine already got a vaccine. Now, I'm not gonna get into the pros and cons of each vaccine or their effectiveness rate or anything. A vaccine is better than no vaccine. If you want or can afford flying to the US twice and therefore paying twice as much, then you can go ahead with a 2-dose, but Johnson & Johnson is the one I picked. Now, let's talk a little bit about cost, because flights booked with short notice tend to be a lot more expensive. Frequent flyer miles are usually not affected that much with you booking a flight that's close to the date where you're flying. At least my flight was 30,000 miles plus like $100, which I thought was very reasonable. But yes, if you're booking a flight for 1 week in advance, it may be hard. I think that even now, with the vaccine doses being so abundant, I think that you can really book the flight first and then just assume that you're gonna get an appointment. That seems to be the case, at least. Even when I was here, I got this like health alert on my phone. They were gonna start taking walk-in appointments. Really, appointments don't seem to be necessary anymore. But do get one, make sure that you have a dose of your choice waiting for you. Now, unless you're doing something else, I think that a full day is more than enough. So I landed here on a Wednesday. I had Thursday reserved for the vaccine and flying out on a Friday. Literally, I was just here for that. I rented a car as I arrived. Cities like this in the United States are usually not very public transportationable. You sort of have to drive. Uber, I guess, is an option, but I figured it would be more expensive in the end. Got the car on Wednesday as I landed, intend to return it Thursday after I get the vaccine, and then I booked a hotel that was really close to the airport so that I could get an airport shuttle car. I used Hotwire, which assigns you a cheap but random car that you don't get to pick, and they gave me this. I do want to highlight some points about the general experience of coming all the way here and the flight and all that. Like, I hadn't been on a plane in over a year. I hadn't been with so many people around me in over a year. It's a little bit contradictory, because they have all these signs, masks required, tests required, keep your distance, but they just cram up that car rental shuttle. I haven't seen so many people around me breathing on my neck. And I long for a concert or a place where people breathe down my neck, but when this vaccine makes effect and makes me immune, and then I still have to wait 14 days for that. But the great part was just the experience at the pharmacy. The clerk at the pharmacy that I spoke to was super nice. As soon as I arrived, he requested my ID. You don't have text. I don't. She will call you. Okay, thanks. And he didn't say anything, didn't bat an eye. Or the woman who actually gave me the shot, she asked me where I was from, and yeah, I'm talking, she had visited Costa Rica, so honestly the experience was very, very nice. That was one of my fears, honestly, to kind of get like raised eyebrows, honestly, because you're stealing a dose from somebody else. Yeah, so let's talk about side effects. So I felt pretty good through the rest of the day. I was prepared to spend most of my day kind of driving around the city chasing a different vaccine. So since I was vaccinated at 8:15 in the morning, I had my day off. Starting like 6, 7, I did start to feel a little sensitive. My skin's a little sensitive, like when you're starting to get a fever. My arm does hurt a little bit. I would call that a 2 out of 5, and it does hurt more than your usual vaccine. It's not swollen or anything. I'm not flexing. Pain, but nothing too serious, and apparently all these are normal, expected side effects. Now I should say, I did spend the night with some fever. After I closed that video, the fever got a little worse, and I actually sweat like the first 3 hours of my sleep. But it was okay. That reminded me about one important fact, which is, if you want to travel to the US in these times, I would recommend that you pay for some travel insurance. You never know if you could get sick or you're going to need to go to the hospital. And you definitely don't want to get sick in the United States.
One Seattle area patient received more than $1 million in charges for COVID-19 treatment.
5 weeks in an induced coma.
Dubbed the miracle child after 62 days in the hospital. More than $80,000 for 29 days on a ventilator.
You think, how can you afford this?
Medicare will likely cover most of these charges, and the federal government did pass legislation to provide funds for coronavirus care.
And that line on the funding for COVID treatment and for COVID vaccines brings me to the reason why I was really hesitant to do this at all, and of course to publish and talk about it in a video.
Some people are spending big money to travel to Texas to get the vaccine. Some of them aren't even from the United States.
Are people from other countries being vaccinated?
Yes, they are. They are being vaccinated in Houston.
Is this legal and is it morally correct?
Vaccines intended for Texans are ending up in the arms of people from other countries.
I get text messages every 5 minutes of people from all over the world. Hey, can you set us up with a vaccine?
Those vaccines are intended for Texans.
The same deals that help develop vaccines are making it harder to get them around the world.
Those that purchased first or made the biggest orders or invested into the research and development are standing at the front of the line, which is why the U.S. has gotten 240 million doses of vaccine, and most of the poor countries in the world don't have 240 million doses combined.
Deals the U.S. made were enough to cover its population at least twice.
The daily average for vaccinations has dropped 20% since the start of the month.
Convincing skeptics to get the vaccine is easier said than done.
10,000 appointments for the county's vaccine sites remain unfilled.
I just decided I'm not going to do it.
I don't know. I just feel like I'm good. I don't need to. I take vitamins and whatnot.
The first thing that struck me was that this is a privilege that comes to people that can afford to spend, I don't know, $500, $700 to just come and get a vaccine, which is, of course, unfair. Myself, I would not have been able to pay for this a few years back. It's a privilege that I'm thankful to have, but that I'm aware that is not necessarily fair. Just because you have money, you can travel and reduce the risk of dying from COVID. Legally, the U.S. Embassy, for example, in the U.S. Embassy in Costa Rica, did issue a statement that traveling to the U.S. for medical reasons, including getting a COVID vaccine, was fair. So according to the embassy, you're not going to get your visa blocked or any legal implications because you can officially travel to the U.S. for that. So hopefully that gives us and everyone some assurance that it's okay to do it. Now, from a legal perspective, from a traveling and immigration perspective. Now, for the states that are allowing anybody to get vaccinated, their position is officially like anybody who wants to get a shot will get a shot. Great, but I'm honestly not sure if this is intentional, that they want foreigners to fly just to get a vaccine, or if it's a loophole that we're trying to exploit. The U.S. government, the federal government, has to pay between $25 and $40 per shot, per giving you a shot of a vaccine, up to $80 if you have the 2-shot version. And that money, if you have insurance, that money comes from your insurance. If you don't have an insurance, like us foreigners, the cost of that comes from the CARES Provider Relief Fund, which is a fund that was created to help healthcare workers and frontline workers in the fight to COVID. So yes, you're not entitled to that money because you're not necessarily a U.S. taxpayer. A little disclaimer here, I'm a little bit of a U.S. taxpayer. I own a company that operates in the States, pays U.S. taxes, and the ads from this YouTube video and from my YouTube channel are, as of recently, taxed in the U.S. So I'm a little bit of a taxpayer and I feel less guilty for it, but yes, maybe I'm not a resident and therefore I'm not entitled to this. That's the part that's unclear, but hopefully with this video you can get a better sense of how it works and you can make your own decision on whether you want to take a shot. Get it? I will gladly pay the taxes generated from the ads on this video as a thank you to the U.S. federal government for vaccinating me. But hope this was useful. If you have any questions, please drop them in the comments. I will try to stick around and answer them. And let me know, are you going to try to get a vaccine?